Hello and welcome to the Quality Insights Practice Module Overview on Social Determinants of Health. This work is part of Quality Insights' ongoing efforts to provide Delaware medical practices with information to assist with improving the prevention and management of hypertension, diabetes, and stroke, and is designed to promote and supplement your current quality improvement efforts. All of the content we'll be reviewing today is only a summary of a printable resource produced by Quality Insights in May 2022. You can find the downloadable PDF version of this module by visiting the Quality Insights website, which is linked here as well as at the end of this presentation. Please keep in mind that the various resources in the module are not endorsed by Quality Insights, and that guidelines and recommendations referenced in this module are to be used along with clinician judgment and based on individual patients' unique needs and circumstances. Should you have questions related to the content, please contact your local Quality Insights Practice Transformation Specialist. The 2022 Social Determinants of Health, or SDOH, practice module provides a framework for identifying social needs in the clinical setting and how the healthcare team can work together to reduce SDOH in Delaware. Designed to supplement the previously released 2021 SDOH practice module, this update includes new statistics and expanded content for leveraging data to address SDOH, identifying social needs via screening tools, including utilization of the Prepare toolkit, implementing a standardized closed-loop workflow, and getting started with connecting patients to local assistance resources. This module can be utilized by clinic leadership to determine next steps for workflow modification and alignment with resources available in your region. Health equity is defined by the Centers for Disease Control and Prevention, or CDC, as a state in which everyone has a fair and just opportunity to obtain their highest level of health. It requires focused and ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. Healthcare organizations nationwide are increasingly looking to integrate SDOH and health equity into value-based strategies. But where should these organizations focus their efforts? Payers and providers are considering patients with chronic conditions because they are disproportionately consuming a significant portion of healthcare spending and system utilization. A few examples are outlined here to reinforce the importance of considering how we can mitigate health disparities among all patients who experience chronic health conditions. Addressing SDOH is a primary approach to achieving health equity, and progress towards eliminating health disparities requires widespread, consistent, and reliable population data. The COVID-19 pandemic has further highlighted health disparities between different races and ethnicities. In order to address these disparities, practices can work to properly document a patient's race, ethnicity, and language data, thus allowing the practice to identify the need to develop diverse patient materials, provide more culturally appropriate care and education, recognize areas where care disparities exist, and develop quality care initiatives to ensure equitable care. If your practice experiences barriers collecting race, ethnicity, and language data, contact your local Quality Insights Practice Transformation Specialist for no-cost technical assistance. Also available for download is Quality Insights Health Equity Infographic, which provides evidence-based rationale and resources related to the importance of collecting this data. Several screening instruments are available to aid clinicians in identifying SDOH in a primary care setting. The National Association of Community Health Centers Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences tool, also known as the Prepare tool, is both a standardized patient social risk assessment tool consisting of a set of national core measures, as well as a process for addressing the social determinants at both the patient and population levels. By using Prepare, providers can better target clinical and non-clinical care, often in partnership with other community-based organizations, to drive care transformation, delivery system integration, as well as improved health and cost reductions. A few additional benefits include EHR integration and abundant resources and helps for implementation. The CMS 10-question health-related social needs screening tool is meant to be self-administered. This tool can help providers find out patients' needs in 5 core domains that community services can help with, including housing instability, food insecurity, transportation problems, utility needs, and interpersonal safety. One tool available to capture data on the social needs of a patient population is the ICD-10 CM codes included in categories Z55 through Z65, otherwise known as Z codes, which identify non-medical factors that may influence a patient's health status. Existing Z codes identify issues related to a patient's socioeconomic situation, including education and literacy, employment, housing, lack of adequate food or water, or occupational exposure to risk factors like dust, radiation, or toxic agents. Utilizing Z codes allows clinics and hospitals to better track patient needs and identify solutions to improve the health of their communities. Clinical leaders can prioritize the importance of documenting and coding patient social needs and allow coders extra time to integrate coding for social determinants into their processes. When implementing any type of SDOH intervention, it's important to engage the whole practice team. Many of the assessment tools provide suggestions for obtaining buy-in from care teams in developing roles and workflows. Quality Insights can offer assistance specific to your practice, such as the suggestion shown here for care team roles and actions for implementing an SDOH workflow. Contact your local practice transformation specialist for more information. Once a patient's needs have been assessed, the next important step is identifying available community partners for coordinating appropriate referrals. There are some options to help you locate these available resources in your area here on the slide, and also linked is an abundance of additional resources in the learning module. Another great resource that's available in Delaware is the Delaware Emergency Medical Diabetes Fund, which provides diabetes services, medications, and supplies to residents of Delaware on an emergency need basis. It provides a maximum payment of $500 per client per 12 consecutive months for items directly related to diabetes that will eliminate or alleviate the medical condition. You can learn more about this valuable program by downloading the Quality Insights flyer that's available in the learning module. You can also help your patients improve their hypertension with a new evidence-based program that empowers them to manage their high blood pressure while learning ways to eat healthier and be more physically active. This exciting CDC recommended program is available at no cost to eligible Delawareans by the Delaware Division of Public Health. In Healthy Heart Ambassador blood pressure self-monitoring, specially trained health coaches teach simple yet proven ways for patients to better manage and understand their blood pressure. Participants in the Healthy Heart Ambassador blood pressure self-monitoring program will receive at no cost a validated home BP monitor if needed, plus training to correctly measure, monitor, and communicate their blood pressure numbers. In addition, the program includes personalized one-to-one sessions with health coaches, nutrition education, and more. This non-pharmacologic approach recommended as a first-line intervention and is also appropriate for all patients with hypertension. Delaware residents can have their blood pressure measured for free at a variety of locations across Delaware. Find locations in your community to share with your patients by downloading these flyers linked here on the slide that were recently updated in January 2022. The flyers are categorized by county in Delaware. Tracking the outcome of a referral to a community-based organization is often the only way to know if a social needs intervention was actually effective for the patient. Follow-up outreach to patients with known social needs is recommended to ensure their needs have been met, to identify any new concerns, and help the referring provider narrow down which resources are the most helpful for patients in their community. The Kaiser Permanente COVID-19 Social Health Playbook, which was issued in 2019, offers the guidance that you see here on the screen for following up with patients post-referral to community-based services. You can find more detailed information about action steps for the frontline care team by reviewing the module. The module concludes with a wealth of resources designed to provide evidence-based support for addressing SDOH in your practice setting. View the module to learn how you can develop a business case strategy for addressing social determinants of health, build an organizational response to health disparities, advance health equity by leveraging data, and address SDOH in rural community settings. I hope today's brief overview of the Social Determinants of Health learning module has been helpful and that you will be able to utilize the information in your practice. We invite you to visit the Quality Insights website linked above to download and review all of the available information for this module. Quality Insights also provides a free e-bulletin that features regular updates and resources for cholesterol management, hypertension, prediabetes, and diabetes. Finally, if you have questions or need assistance with implementing quality improvement activities in your practice, a Quality Insights Practice Transformation Specialist is here to help. Please reach out to us at any time. Again, thank you very much for taking time to review today's recording. We hope you have a great day.